I'm Dr. Ray V. Jensen. I work for Monument Health in Spearfish, South Dakota, and I'm a board-certified orthopedic sports medicine surgeon. Mainly with the ski season approaching, we have Terry Peak, which is located in the northern hills, and so we typically see a lot of ski injuries. Those ski injuries can relate to minor bumps and bruises to more fractures, dislocations, and or more commonly knee injuries and shoulder injuries. Each injury is unique in itself. Most injuries in skiing revolve around velocity and mechanisms of injury. So fall from standing skiing with high velocity, trees, impact. A lot of the more common ones are just simple people that are coming from the Midwest that fall on an outstretched arm and sustain just a simple arm fracture, elbow fracture. Knee injuries are very common in skiing because your feet are fixed to long skis that make the mechanism for your injury a lot more severe. So that twisting injury ACLs are very common if you follow the ski season. High velocity fall, typically it happens when people fall into and kind of fall back, and so they'll rotate a little bit onto their knee, and that forces the ACL in a very vulnerable position, which will then rupture that ACL, or MCL would be more common as well. The biggest thing with any kind of winter activities is ice, right? Ice is notorious for being slippery, dangerous, losing your footing, and so just really maintaining a good contact with the ground, shoveling your driveways, de-icer is really great. And then you also can, there's various devices to wear on the bottom of your shoes, so make sure your shoe wear is appropriate, and kind of going from there. In terms of skiing, preventing injuries from skiing is just overall conditioning and any kind of outdoor activities to make sure your health is okay and you're not just getting out there and always paying attention. The treatment will basically range on the severity of the injury. So simple injuries, a knee sprain or a bump or a bruise, can be treated with conservative care, meaning just local care to, sometimes physical therapy, ice, an oral medicine, sometimes herbal medicines, and then the severity would get on to, we might have to put them in a brace, or we might have to do some injections or a cast if it's broken. With the knee, we're treating these higher severity injuries in terms of ligamentous injuries, ACLs, MCLs, with surgical intervention, and that's where I come into play. That's my job, to perform those surgeries and to correct the instability in the knee, which has resulted from that twisting, pivoting injury. For simple things, it could be easy. It just could be some rest, ice, heat, activity modifications. Maybe you don't ski for a couple of weeks. Maybe you take it easy and you're not out on that fat bike for a little while. But that gets into longer, prolonged surgery or recovery time, depending on if you need surgery. But a typical knee injury in terms of an ACL can be 9 to 12 months for recovery. So again, the ice. I'm going to touch back on ice because in the winter it's cold here in South Dakota, and so that ice sticks around. But I also too see some other injuries in terms of shoveling snow. That's a common one around here. You got a lot of folks that are advanced in age, some retirement here that stay in the winter, and they've got to shovel their driveways. And we've had a couple big storms that cause some shoulder injuries, back injuries, and then more of a comical relief one is starting the snowblower. I've seen several people that tear their rotator cuff starting that snowblower. And so, always be cautious in how you're positioning when you're shoveling snow, when you're starting snow blowers, when you're walking around, when you're shoveling snow. So those are the more common ones, but I've seen it all.